assalamu alaikum, good morning, khushamdeed, jai ayanu, goeiemorgen.
Pakhairagale, ni hao, junashumme, washwale, ohio, genzaimes, guten morgen, hola, bonjour, privyet, kaifahal, alishuma chatore, ahlan wasalan marhaba, buna, mucho, gracias, swabiab, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning alongside the very amazing Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I am absolutely great. Cannot even start with, how great energies I have this morning, probably because I overdosed on coffee.
It's great. It's great how you can overdose in coffee, but because I think just because of this thing, I remember one more incident which actually took place with me. So I was traveling from Lahore and I was all by myself. So first things first, ladies and gentlemen, we definitely want everybody out there to be happy, healthy.
Yes,
but it's time to rise and shine, wake and bake, get up. But now coming back to what I was about to mention, so Shiza said that she kind of overdosed on coffee or caffeine. And this is the exact same thing which happened to me. So I was about to leave from Toka. And I had to come to Islamabad for another show. And since I was very tired and, I had to do it on my own most of the time. So what I did was that the stopover I stopped at, they had like some very amazing branded coffees. So I picked up 3-4 of them. And, after every hour of my drive, I'll drink one. So the second, after the second hour or after the third coffee, I just didn't know what was happening to me. I wanted to do so much. I wanted to do push-ups in the car. I was so full of energy. I was so pumped up. But then at the same time, I was not feeling very well. So I think that's the overdose feeling of coffee.
Yeah,
so please, have it in limits. have it in limit.
No, but I really had to, Shahzad, because all of you who are watching right now, if you're watching this live, I'm going through my exams for this week.
Yeah.
And it's such, the routine, it's so hectic, of course, because this is almost my last semester as well. I'm working on my thesis too, then there's this job. So I did need a lot of coffee.
Yeah.
But the show was also really important, Shahzad, and we saved this one to do this on the end of October, of course.
Yeah.
Because everyone out there who is watching right now, if you're belonging to Pakistan, that's amazing, to so many different countries of the world as well. We love, educating you and awareing you about things that are so essential to us, really. And because this specific issue that we're going to talk about, it's so commonly occurring, and especially in women, ladies and gentlemen, it's the most commonly occurring. Let me just say it's breast cancer, ladies and gentlemen. And as we know, October, the entire month, we observe, and I can't say celebrate, but we observe it as Breast Cancer Awareness Month. And there's so many seminars going on and, so many walks going on, whatnot. And there's a certain purpose behind it, of course.
Exactly. And then at the same time, ladies and gentlemen, at the start of the next month, hopefully we still believe that things are actually going to turn out to be very positive for Pakistan.
Inshallah.
I hope that this is how it is. So Shifa International Hospital has actually organized a bicycle rally as well, just to spread awareness. Because, ladies and gentlemen, it's not the disease itself. Obviously, there's been a lot of advancement in the medicinal techniques and the type of screenings which are available, but it's the stereotypical thinking process we have over here in Pakistan, where people cannot speak openly about these organs. And I think that it is about time that we spread awareness about all of these issues as well, because a lot of women and at the same time men have even lost their lives because of this particular reason, because earlier in the first or in the very early phases it was not detectable, the disease itself, and the kind of screenings which are available weren't even helping, and people never had an idea of what kind of disease they had. So now finally, when we have so much technology, I think that it's about time that we use it.
But Shahzad, yes, of course, there's a lot of technological advancements, and now we can literally, nip the evil in the bud. But here's the thing, it's still stigmatized in some parts of the country, of course. My paternal village happens to be somewhere near Sargodha. It's really, really, sort of a typical Pakistani village, let's just say that. And a random woman I spoke to was really not feeling well and sick, and I spoke to her. She goes like, I think, I'm not really sure, but I think I have breast cancer and I'll have to die with it. I was like, hey, hold on. First of all, how do you think? Second of all, you really have to do something about it. And then she goes on like, I'm not really allowed to discuss it even with my husband or my son. I'm not allowed to go to the hospital, go to the city. It's so unfortunate, Shahzad. Of course, while these facilities are available for a lot of people out there to use, to utilize, still, a lot of people in Pakistan specifically are so far away from all these
things. And ladies and gentlemen, the process is very simple. All you have to do is, thankfully that I went to a good school, and Alhamdulillah, I'm always going to be thankful to Allah Almighty for having bestowed so many blessings upon us. So our school teachers actually used to tell us that, okay, while you're taking shower, you touch your private parts and you feel as if there is a lump or something. So that's the first thing which you really need to go talk to your parents about and get it checked. So, if we start at such a young age, I don't think that people will perceive it differently as well, because we over here people over here have a very different perception of things which are related to your private parts, and they get excited without a reason. And for all of those people who are out there, ladies and gentlemen, me and Shiza and the entire team at PT World, we believe that it is our responsibility to let people know, to make you guys aware of each and every aspect which is out there, and be safe. We just want you to be safe. So we're going to dig in a little deeper. We have some very amazing doctors over here and surgeons over here in the studios with us, but we're going to introduce them to you right after a short break. Don't go anywhere, because we really care about you. Good morning.
Stay tuned. Welcome back to Well This Morning with Shahzad Khan and Shiza Hashmi, ladies and gentlemen, on a very informative morning today, where we have dedicated the entire show to the awareness of breast cancer. And without further ado, because we already spoke a lot about it, let's introduce our guest, because we have so many questions to ask.
So, ladies and gentlemen, with us in the first place, we've actually been joined by a consultant oncologist. She's none other than Dr. Saira Hassan. Hello, ma'am. Assalamu alaikum. How are you?
Walaikum assalam. I'm fine. Thank you very
much for joining us.
Thank you for inviting me. Thank you.
And alongside Dr. Saira, ladies and gentlemen, we have been joined by another consultant surgeon himself. He's none other than Dr. Arif Malik. Hello, Saira. Assalamu alaikum.
Walaikum assalam.
And thank you very much for joining us.
Thanks for having us.
And thank you very much for bringing these badges for us.
Oh, yeah.
Well. Thank you very much once again. And last but not the least, ladies and gentlemen, once again, we have been joined by consultant radiation oncologist. He's none other than Dr. Muhammad Farooq. Hello, sir. Assalamu alaikum. How are you?
Assalamu alaikum. Thank you very much. It's a pleasure to be here.
Thank you very much for joining us. It's wonderful to have you. But the first question which I wanted to ask, and I've always wanted to ask this question, but I've never found a very amazing answer to this question. Why do we get cancers anyways?
Actually, that's a very good question. There are so many factors which are behind it. Lots of them could be explained by genetic predisposition, because there are certain families which have very high risk cancer producing genes. And those families, they are predisposed to getting cancer. Apart from that, chemical exposure, environmental factors, they can cause cancer. And usually, sometimes you have associating factors like smoking, alcohol, eating pan, chalia, all of these things. And they are very common with oral cancer. For breast cancer, BRCA gene is one of the genetic cancer associated gene. And that is a very common cause.
These are some of the factors that may cause cancer. And since we are today specifically talking about breast cancer, can any of you tell us the prevalence stats of breast cancer in Pakistan?
Just to add to what Dr. Saira was saying about your question, Shahzad, not to forget obesity.
Absolutely.
Right, so we are getting affluent, less exercise, more westernized diet. We put on a lot of weight. So obesity is one of a major risk factor for colon cancer, uterine cancer, and breast cancer, what we are talking about today. So I think we should take obesity front on, beside its underlying factor for diabetes, heart disease, etc. It's an underlying cause of cancer as
Exactly. And thank you very much for saying that, because recently, ladies and gentlemen, me and Shiza, we did a show where we were actually talking about how obesity can cause so many problems. And obesity, I think, that should actually be treated as a disease. But over here in Pakistan, our mothers have a very different concept of obesity. They're like, beta, tu jab tak gol nahi hoga, to acha nahi lagega.
Yeah, ek aur paratha, please.
Yeah, and even when you tell your mother that, ma, I am on diet and want myself to be fit, beta, tu paratha kha, tu fit ho jayega. Not knowing that, that it's not even the paratha or the bread, it's the amount of food you are eating. And I think that everybody needs to take it under consideration, because you live to eat, that's the kind of story for people who are actually obese. In fact, if your life should only be revolving around food. Please make sure that you don't do that, ladies and gentlemen. We love you. Literally, we do love you.
No, that's why we're holding this show.
But sir, moving on to you. Now, let's talk about breast cancer. The entire month is dedicated to breast cancer. And I want to give a shout out to Mr. Aftab as well, because he was one of those people who pioneered with the breast cancer awareness, ladies and gentlemen. But sir, how do you think that this entire month has been? And do you think that we've achieved a lot of, in numbers, a lot of people? Do you think that we've reached a lot of people? Or do you think that we still have a longer way to go?
Thank you very much. I think like this show, it's in English.
Yeah.
So obviously your audience is going to be smaller compared to what we have.
Smaller in relation to Pakistan, but other than that, we go out in 46
absolutely. But what I meant was the real problem lies in the rural areas. And I'm not too sure how affluent and how educated that part of Pakistan is.
Yeah.
So apparently that's the area where we should target.
Okay.
With these kind of activities, which are walks or awareness seminars or programs, which actually are destined to make people for primary prevention, which means making them aware.
Exactly.
So being a female, itself is a risk factor.
Okay.
So if you look at the stats, there are two peaks when cancer comes in the females. One is in 30s, and the second one is in 55.
Okay.
So obviously, when you're looking into these kind of statistics, you would be very, very keen to know who is at risk.
Okay.
So these kind of seminars and TV talk shows or media campaigns actually reach out people who are affluent, who can understand, who know what is physique and diet is.
Yeah.
So as a cancer treating physician, it has been a common observation that when we are in the clinics, every 8th file or 9th file is a breast cancer file. And every second patient is a patient who comes on a stretcher. Okay. It's not uncommon to see the disease beyond the limits of cure. That means either it's gone into the bones, or it's gone into the lungs, or it's into the brain.
Yeah.
So that's the time when we say, oops, somebody could have picked it at earlier age. And those social dilemmas and stigmas of being labeled as breast cancer are the main factors, other than the social and probably religious beliefs.
Exactly.
So this is the area which needs to be worked on.
And we have been on it as well, which is why, ladies and gentlemen, it came up to my surprise when we were actually talking about, during the entire month, whenever we used to talk about breast cancer, this was one thing which one of the doctors said who was on the show prior to you people as well. And he said that, it's not just the women who are actually prone to breast cancer disease, it's actually men as well. And I didn't knew even before that day that it can actually happen to us too as well. And I think that, it is very important for everybody out there to know. But other than that, that this disease can actually get its hand onto a male or a female, what I want to know is that, do you think that we've progressed in terms of the way we used to do the screening? Because most of the times, the cases I've heard about, it got to a stage where it wasn't really controllable.
Well, actually, what Shiza was alluding to earlier, there's a lot of stigma associated with breast cancer, and especially with females.
Yep.
I think sometimes they are reluctant to go to a male doctor. Maybe that's the reason why they don't seek medical attention. Because luckily, there are so many cancer centers in Islamabad, in Rawalpindi, in all of Pakistan. Because cancer is very common, especially in Pakistan.
Okay.
1 in 8 women is going to have breast cancer.
Okay.
And nobody is immune to it, no males or females. So if you notice any breast swelling, they should go to a medical specialist. But they don't seek medical attention because they think the swelling is painless.
It's going to pass, it's just another thing
So
maybe.
they think it's nothing to worry about. But unfortunately, the painless swellings are the most worrisome swellings
Oh.
because they need to be biopsied. They are more indicative of cancer.
Okay, so how can, I mean, we've spoken about self-diagnosis a lot about, on our
Yeah.
show as well, but for everyone who's watching right now, this particular show, ma'am, or any one of you, can you please, for the audience out there, for the layman, explain to them, like you said, it's really important to catch it even if it's painless. How can one diagnose that maybe there's something wrong with us?
So, for example, if you notice a breast lump which is growing in size and which is mostly painless,
Okay.
it could be painful as well.
Okay.
But if it is painless, don't ignore it. That's the commonest reason we hear from the patients, that it was painless, we thought it was nothing, so we didn't come. So if you have a painless breast lump, don't ignore it.
Okay.
Okay.
You have to get it biopsied.
Yeah.
And Dr. Arif can elaborate, probably he sees a lot
and
of these
before you
patients.
elaborate, there's just one small thing which I wanted to add to, because I had a similar issue where you know, the lump wasn't actually connected with the skin, and then there are lumps which are actually they're just stuck to the skin as well. So what's the difference in both of these lumps?
Well, just to get the discussion ahead, I think the key issue is that everyone should be aware of what is normal and what is abnormal.
Okay.
So, very rarely you will find, kids born with some congenital problem.
Exactly.
Like a swelling on the forehead or the back of the trunk or stuff like that. But most of the adults should be aware. So I think in the current day and age, the stress is what you were trying to ask us, how to pick it up at an early
Exactly.
stage. I think if women, or for that matter men, knowing that they are living in a high-risk family where multiple family members had diagnosis
cases.
of breast cancer, they should be more aware, and the general population also should be aware of what is normal and what is abnormal.
Exactly.
Your
Agreed.
question, what is attached to the skin, it is very superficial or deep,
Yeah.
it is inside the organ or outside of it. My message is, if it is abnormal, right, if
go
there
to
is a finding, go speak with your physician, get your physical checkup done. And if the physician says, hey, this is something related to your sweat glands or a sebaceous cyst, you need to get it out, or we can wait, or you need an ultrasound, you need a mammography, you need an MRI, or whatever, or a biopsy, just to get to the bottom of it, that it could be a cancerous lump, it could be a benign lump.
All right.
So it could be anything. So you need to go to the specialist.
Yeah.
Okay.
And just a couple of quick points.
Yeah.
Dr. Sara said every 8th woman in Pakistan is at risk. We are 2.5 times higher in our region, the risk of breast cancer, higher than India, higher than Iran. There are a lot of factors, intermarriages in Pakistan, genetics. We don't know a lot of things. We don't know about our Asian populations, but we have a lot of data from the West. So genetic plays a part, environment plays a part. We talked about obesity, the quality of food that we are consuming, that contains carcinogens, even in medicine or in our food or in our water or in the air that we breathe in, smoking, alcohol. So all those are risk factors. So I think message is, if there is anything abnormal, it came up, you were not born with it, go to the specialist doctor. Don't go to anybody who is not used to seeing these type of conditions.
Exactly.
So that is also very important. Women, just like Dr. Sara said, like to go to their gynecologist. They use the gynecologist. No offense to the specialty, they do a great job day in, day night. But they are not trained. The oncologists are trained, the breast surgeons are trained, population need to know, the government and us need to tell them, this is the center which has equipment to diagnose certain conditions.
And
All
thank
right,
you very much for mentioning that as well. So I'm just going to take another minute and move on to Dr. Saab over here. So Dr. Saab, something very similar happened to me. I had problems with my shoulders. Couldn't move them very easily. So I thought that, it'll be better for me to go to a neurophysician. And this is what I did. So I went to a neuro and he did all my tests. I spent 25,000 rupees. And then he finally said, oh, you know, your problem is actually for somebody who's a rheumatologist. Now imagine that this kind of confusion has actually costed me quite a lot of pain, quite a lot of money, and then even till date I haven't figured out the solution. So I think, what do you think that we really need to do to make sure that people actually go to the right person? Because you know there are so many subcategories within the field of medicine that they actually get confused. यार अब हम हड्डियों वाले के पास जाएं, अब हम कंधों वालों किसके पास जाएं?
Yeah, it's a very, very important thing. I think the take-home message from what I'm going to say, it should be very simple. So you've got a lump, because this talk is about breast cancer. So you've got a lump in the breast, whether it is attached to the skin, or it's not going away, whether it is, you know, with pain or without pain, you've got discharge coming out of the nipple. And not necessarily a lump in the breast, it could be in the armpit. That means it has gone into the armpit. And we got these patients who are coming with bone pains or shortness of breath, or they, you know, develop jaundice. So that means the disease has gone into the bones or the liver, or, you know. So you have to be familiar with your body, as Dr. Arif said. So you should know what is your normal. So if you look at the guidelines, they say you look at your body at least once a month, sitting.
I look at it every day at the gym, man.
So that's for the common people to know, that when you give so much time to your kids, your family, you need to give some time to yourself. It could be 10 minutes a day, it could be 1 minute a day. So be aware of your normal breast and talk to people. So if you have a lump, that's not something which is asymptomatic. So when we say secondary prevention, that means you're picking the disease without symptom being there. So asymptomatic disease, for instance, there are risk factors we mentioned. Let's categorize them. If you're a woman, above 45 is the time when you start, you know, doing imaging. We call it mammography. We have obesity we talked about. Not only obesity, gaining weight or being fatty, it's your diet, lack of physical activity, having diabetes type 2. These are risk factors which are associated with cholesterol, and cholesterol is the precursor of estrogen. And estrogen is the one which causes cancer. That's why they say if you have early menarche, that means your menses are earlier than normal, 13, 14, your risk goes to 20%. So let's say your child has started menses at the age of 11, or you're a female who's supposed to end her menses by 48, but you're ending at 55, your risk goes up. So these are the type of risks which you should be aware of. Then not having pregnancy till 35 increases your risk to having a cancer of the breast. Having a cancer of breast and treated and you're cured, having it on the opposite side, that makes you a risk. So these are the types of things you should look for. And you should not forget, there are patients who are taking fertility medicines. They are sort of not causative, but there's one drug called clomiphene that is thought to be cancer causing. More so, I think hormone replacement therapy after postmenopause, and in the West, and now as we are westernizing, you know, taking oral contraceptive pills containing estrogens in specific, they cause increase in your risk of having breast cancer. So don't forget oral contraceptives. But if you've taken it for 2-3 years under a gynecological consult, that risk is there. But if you take it for a longer period of time, the risk doubles. And if you stop it in 10 years' time, your risk comes back to normal. So really you need to define what are the environmental factors like radiation, pesticides. These are the kind of things, you know, getting a CT scan without a reason for a young girl, I think that's totally, you know,
that
ridiculous.
can be causative as well.
A single X-ray can cause a cancer. So radiation
single
is a
X-ray can cause.
A single X-ray. You see, when you said what is the cause of cancer, the cause of cancer is one. That is a genetic change. So how many times your cell is insulted by a mutagen, may it be chemicals, drugs, lack of exercise, obesity, fat, insulin, whatever, you know, all cause potentially a damage in the cell. A damage is normally repaired, but when the policing of the body is impaired, they cannot pick the damage.
Thank you very much for saying that, and you've actually made us understand it, because we're not doctors, you know. I think that's the crux that you actually get to understand, because usually we do have doctors over here on the shows, but they use their own jargon, you know, malignant and, you know, stuff like that, which is very hard for us to understand. Which is why I'm going to ask you another layman question. So you know, since you spoke about estrogen and how estrogen levels can be linked towards breast cancer, so the estrogen, does the male body have estrogen levels as well, other
Everybody
than testosterone?
Everybody has, Shahzad, estrogens, but the level of estrogens is very high in females because ovaries produce it.
Yes.
But with us, it's the estrogen content coming from the fat.
Okay.
And you know, there are enzymes which actually convert the cholesterol, which is the precursor molecule, into estrogens, and actually they're derived from the testosterone.
Exactly, because this is what my trainer said. He said that, you know, you get your estrogen levels tested as well when I was very fat, and I didn't do that though, but yeah. So I just wanted to be on the safer side.
That's a very good thing, right? We need health for everyone out there. So we have spoken a bit about the basics, of course, but now I want to speak specifically about the campaign this year. So my first question, I mean, we have spoken about the facilities, the availability, whatnot, but there might be some people who are not fortunate enough to maybe afford the facilities, maybe even to get there and whatnot. Where should they go? Because every life is precious. There's no difference. I mean, not for me at least.
That's where Shifa Foundation comes in.
Yeah, so please.
Absolutely. So Shifa Foundation is made for patients who cannot afford this, and the treatment for cancer is very expensive.
Yes.
But sometimes the only reason behind not getting treated is the fear that we just don't want to find out. So people can spend a lot of money going to these people like quacks and dumb and all of those other things, and they don't come for a proper diagnosis.
Exactly.
There are some charity organizations like Shifa Foundation, Shifa Cancer Hope. They all try to cater for patients who cannot afford the treatment. INMOL and other hospitals, PIMS, Noori, they also cater for patients who cannot afford treatment.
But should we just add, like, we are an independent organization and our charity is basically dependent on philanthropy.
Yeah.
But you know, the public's departments, which are probably from Pakistan Atomic Energy Commission or the government hospitals, they have access to huge amounts of zakat fund and Baitul Mal.
Exactly.
So that's enormous. And being Shifa, despite being Shifa, it's considered a private organization. So we don't have access to those kind of organizations.
Exactly.
So money is a problem.
Exactly.
You know, diagnosis is one part of the show, and then carrying on the treatment is another part of.
Exactly.
And that's where the government has to chip in. Sponsors need to chip in, and philanthropy needs to chip in.
And I'm glad that you actually brought this up as well. But then at the same time, ladies and gentlemen, since I've been, well, I've said quite a lot about it, but now since the program is back on as well, because for CML patients, they're giving away, Punjab government and Baitul Mal, they're giving away to Cigna and Gleevec and, you know, all of these medicines for free because they're very costly. But I think that this is another area where people need to tap in, and you know, I think that it is about awareness. When people are going to get to know that this is how expensive the treatment is, and you know, if they cannot afford it, once they're going to raise their concerns, I think that's the time when the government and the private parties are going to chip in.
So can I add, Shahzad, like, you know, in the West, what they do, they can't afford oncology treatment themselves, like in States.
Exactly.
So it's where the insurance companies actually come. So at least in the affluent society, at least in the urban population, we need to propagate that get yourself insured.
Exactly.
A mammography can be done free of cost if you're insured. Because that's diagnostic.
It's not a very common culture or practice in Pakistan, though, medical insurances, which should be. I do agree with that. And of course, I mean, like we spoke, Shahzad, there are some people who will never probably even find out what's wrong with them. Even if they do, they won't be able to afford, you know, treatments and whatnot. And I think we were in conversation with one of the producers as well, where he was sharing the story of a woman from his village who unfortunately passed away because of breast cancer. Because she never had the courage to share it with anyone. I mean, she was fearful of what people are going to judge and whatnot, because you know how it's a stigma still. So many things would stand here, and ladies and gentlemen, our only purpose of being here on this show is for everyone out there to learn and then spread as well, because this is something that can happen, unfortunately, God forbid, to any one of you.
Exactly, which is why, you know, let's break it down a little and talk about the solutions we have, which are available for people out there. So is it more prevalent in rural areas or urban areas?
Oh, we do not have
anything. I mean, because the type of patients who walk in, you might be able to recognize.
That brings you to a gray zone. We do not have a national cancer registry, so we don't know what is the extent of problem. Whatever we learn is through prevalence.
Okay.
Okay, you know,
so what have you learned so far? You know,
so
that's what
you know, if you go back to 1980s in America,
Yep.
their incidence was quite high.
Yep.
But they were able to know two things. First, mammographic screening.
Yep.
That reduced their chance of having, picking these cancers at a very, very, very early stage and made it curable.
Yep.
And second was they realized that oral contraception,
Yep.
which is an essential part of their culture,
Exactly.
they started knowing that this can potentially cause cancer in the breast as well as uterus.
Yeah.
So they started avoiding it. So the word of mouth spread it that this is a disease which is potentially curable. Like we say, hepatitis B, when a patient with hepatitis B has a liver cancer,
Yep.
your survival is like 5 years. So they say, Doctor Saab, kya karna chahiye tha? So I always tell them, it's a very preventable disease. Get a simple vaccination and you won't have the cancer.
Yeah.
So now hepatitis C as well, like you have this drug available, you can eradicate the disease and your chance of getting
Wow.
the cancer because of that, it goes down. But we don't have vaccines for breast cancer
breast
Yeah, we
for
don't.
this age, in time. But screening is the answer. So if you think you're at high risk, with all those factors all of us
Yeah.
describe, you're at risk, you start your screening. It's
Exactly,
cheap, actually.
and if you're not willing to go to a male doctor, ladies and gentlemen, we've got Dr. Saira over here as well, and there are a lot of other female doctors who are actually rendering services for all of those people who are out there. At this point of time, we've got a small report to share about breast cancer. Go ahead, take a look. When you guys will come back, we'll talk about the solutions which are available if in case, unfortunately, you have to go through it.
The Breast Cancer Awareness Month, marked in countries across the world every October, helps to increase attention and support for the awareness, early detection and treatment, as well as palliative care of this disease. There are about 1.38 million new cases and 458,000 deaths from breast cancer each year. Breast cancer is by far the most common cancer in women worldwide, both in the developed and developing countries. In low and middle income countries, the incidence has been rising up steadily in the last years due to increase in life expectancy, increased urbanization and adoption of Western lifestyles. Each year, more than 22,000 people are diagnosed with breast cancer and 40,000 die from it. Breast cancer does not just affect women. Men can get breast cancer too. Many people survive breast cancer if it is found and treated early. Early detection through routine screening has helped increase the survival rate for many cancers. Women are encouraged to do self-exams and get annual checkups and mammograms. To reduce your risk of breast cancer, keep a healthy weight, exercise regularly, and get enough sleep.
So all you have to do is exercise and make sure that you're sleeping enough as well. Ladies and gentlemen, the entire initiative, even though that it's not just ours, we cannot claim about the initiative, but I think that everybody needs to play a role in it. Everybody needs to be a part of it, and everybody needs to raise voice about it as well. But very quickly, since we are only left with last 5-6 minutes, so what we're going to do is that we're not going to ask you any questions. So from the screening till the time that anybody is going to get operated or the type of treatments which are available, please can you go on about it and let us know?
Can I just start? Like,
Sure.
once your patient comes to you and says, all right, Doctor Saab, मुझे cancer हो गया है, इसका खर्चा कितना आएगा?
Yeah.
So let me tell you, in our part, like 1 million is gone.
Okay.
Once you are diagnosed with cancer, surgery, radiation, chemo.
Everything.
So it's just a question,
Yeah,
and you have to think about it. How about a 3,000 rupees mammography?
yeah.
And pick it early than
Exactly.
to spend 1 million rupees to get a cancer, the physical trauma, the psychological trauma, and the financial drain.
Yeah,
So-
exactly.
So
And-
it's important, So
And you might not
mammography.
even have to spend 3,000 rupees if you have a healthy lifestyle. I think that's what the point is. I mean, mammography, ladies and gentlemen, is important and essential for everybody who's out there because anybody can be at risk.
Yeah.
But, going to a doctor once you feel that there's a lump or there's any disturbance, I think it is a little too late. So for everybody who's out there, first of all, you have to stay healthy and active. And if you think that you might get yourself tested, please go ahead, get yourself tested. Dr. Arif.
So Shehzad, 98% cure rates if you are in stage 1,
Okay.
right? 0 or 1, right? Still in 90s survival if you are in stage 2. It gets down to 70 and a dismal 20s if you are stage 4.
Okay.
So that's the importance of screening. On a positive note, there are all good curative treatments available these days, targeted treatments, early detection measures. Women in rural areas, government has initiated health cards. So if they can have that facility, get yourself checked by the nearest mammogram unit at least. There are 2D machines, there are 3D machines. Shifa International has 3D machine. We offer 50% discount as well. I don't like to sound like a salesperson, but this information is important for women. It is known from the data that if you offer the screening test and breast clinics closer to where women are working, where they are residing, it is more convenient for them to come forward and avail those facilities. So we have a one-stop breast clinic in Shifa, just like any other bigger hospitals in Pakistan. So women can come in, we have trained nurses, the nurse educators and coordinators who can help with all navigating through the complex hospital departments. And we have team of specialists, oncologists, breast surgeons, radiation oncologists, plastic surgeons, when the question arises for the reconstruction part, palliative medicine physicians, physical medicine rehab professionals. So it's a team effort. So once a week we sit down on a Thursday, we discuss all the newly diagnosed cases in our breast MDT. So the patients get the best of the best input as to what best treatment can be offered to that particular. Now, one myth is that everybody in our hospital will say, Doctor Saab, wo neighbor ka to ye ilaj hua tha, friend ne ye keh diya, colleague ye डरा रही है,
So many
और वो ये
opinions.
कह रही है. So one size does not fit all वाली बात है.
Okay.
It's a customized treatment based on their tests, their hormone profiles, their scans, etc. So the patients have got the treatment that is best suited for their age group, for their stage, and for their disease variety, because there are a lot of different varieties of breast cancers available.
Thank you very much for saying that. And very quickly before we wrap up, so each one of you is actually supposed to give one piece of advice how to avoid breast cancer, starting from you, ma'am.
Okay, my only take-home message will be for all the women out there, please don't be scared. Just if you do think there's something abnormal going on, get yourself checked out. There are many doctors available, and there are female doctors. Even if you have to go to a male doctor, it doesn't matter because it's for your health. So breast cancer is curable. If you detect it at an early stage, there are many treatment options, and don't be scared. Go to a good medical professional.
That's great.
All
Thank
right,
you
don't
very
be
much. Dr.
scared.
Arif, what would you say?
Well, your question about how to avoid it. Unfortunately, people with the best of the best, facilities and lifestyle may still get cancer.
Yep.
So the key is early detection. Key is to know your risk, to know if your mom had breast cancer, say mom was at the age of 40 years.
Yeah.
We are seeing people at 20 years old getting breast cancer these days in Pakistan. So
Exactly.
this doesn't know any age group.
Exactly.
So वो वाली बात है कि जी ये हमें तो नहीं होगा, ये दूसरों को होता है.
Exactly.
ये शायद हमें.
Right.
So don't be in that type of a mindset, right?
Ignorance.
So there's a positive mindset, know your risk, healthy lifestyle. When you get any symptoms, go to a trained physician, get yourself checked pick it up at an early stage.
That's great, and thank you very much for saying that. But before we move on to Dr. Saab again, ladies and gentlemen, I think that he's raised a very important point over here, because if you go back in time, if I'm supposed to speak about my grandfather or my grandmother, we do not know whether they had such problems or not, because they never went to doctors. So I think that having such brief family histories can actually cause a lot of problems as well. But Dr. Saab, any take-home message?
Yeah, it's important to know that there are things which are not in your control.
Yep.
But we'll talk about things which are in your control. So one thing is physical activity.
Yep.
Adopt a simple life. Eat less. Try half an hour exercise every day, at least 5 days a week. Avoid oral contraceptives without doctor's advice. Do not delay your pregnancies if you're married. Try to have kids, 2, 3, 4. You know, and obviously, as Dr. Arif has said, you should be familiar. If you have a family history, one or more cancers in the family with breast may be a reason. Earlier age cancer, less than 40, makes you susceptible. So be aware of your body and of your environment as well.
All right. Thank you so much for saying that. Thank you so much for being here and awareing us, educating us, everyone out there as well. And just one more thing. In the first week of November, ladies and gentlemen, Shifa Foundation is holding, Shahzad already mentioned in the beginning, a cycling rally, of course, for the awareness of breast cancer. Is there a certain website we can log on to and find all the details as well?
Yeah. So I think you are supposed to let us know. What's the website? Nahi, Salam nahi, website kya hai? www.shifafoundation.com. Ladies and gentlemen, please make sure to log on. It's for a cause. Get yourself registered, get your bikes ready, and we're going to do it together. Let's do it, and please make sure that you write to us on our Facebook page, which is with the name of
Well This Morning.
On Twitter.
Well This Morning without a G.
And let me tell you, this is going to be one of the best wrap-ups I've ever done in my life as well, ladies and gentlemen. Please make sure that you join us on our YouTube channel as well, which is with the name of
Well This Morning.
And the fabulous repeat is going to be at
5 past 11 p.m. tonight.
Till the next time, 1, 2, 3.
Good
Good morning. Thank you very much.